Hi everyone, this is Sharon again, and I'm speaking to you today about the different stages of ovarian cancer. This is a very important thing to know because it determines as to how your cancer will affect you depending on the stage that you are in. And it also gives the doctors an idea as to how your ovarian cancer will be treated. So there are 4 stages to ovarian cancer. There are 4 in all, 1, 2, 3, and 4. Of course, I'm stage 4. That is the most the widespread one, where your cancer has totally metastasized into different points of your body. And so that's the stage you really prefer not to find yourself in. And that's what I'm hoping to prevent today, is by giving you an idea of what the stages mean for you and what type of treatments will ensue as a result. The staging is basically a process in which they try to find out just how far the cancer has spread. Now, let's say your doctor may have an idea or a little estimate of what stage you could possibly be in, but that's kind of at the clinical stage and not quite as effective. So don't just rely on that. If you find yourself getting past the point of that and you're finding yourself absolutely going to surgery to have that condition taken care of, it is then at this point of surgery, which we call, they take the tissues, and at the pathology stage, they send it off to pathology, the tissues, from your surgery to determine the more exact stage of your ovarian cancer. It is then at this point that they really have a better idea of how your cancer will have to be treated. Okay? So like I said, there are 4 stages of cancer and ovarian cancer. I'm actually reading some of them from this book here. I'll show it to you. It's a little manhandle here, but I've had it since 2007, and it was actually given to me, as you can see there, by the American Cancer Society. And as you can see, it says ovarian cancer treatment guidelines for patients. And you see there, April 2007, American Cancer Society. Now, this book was given to me in 2007, and American Cancer Society helped me a whole lot with information on understanding what I was going through. But at that time, I didn't appreciate the book enough to know how informative it could have been for me, and it would have taken a lot of the fears that I had away. But at that time, I just wasn't ready. You know, my life had already been turned upside down with cancer, so the last thing I wanted to hear about was more cancer. I didn't want to read about it. I didn't want to hear it. I was in serious denial. So this book here sat around for all these years, until about a couple of years ago. I began reading it. I was ready. Let's see if you can get a better picture. I was ready to absorb all the information that I needed to know about ovarian cancer, and this book has just been awesome. So there are ovarian cancer stages. Stage 1, Stage 1A, and it means basically that the cancer has developed in an ovary and hasn't spread out onto the outer surfaces. You have a Stage 1B. The cancer has developed within both ovaries, but it hasn't spread into the outer surfaces, nor or any of the cancer cells found present in any of the abdominal washings, nor are they seen under a microscope. So there's no evidence under a microscope. Stage 1C is that the cancer is present in one or both ovaries, and that one or more of the following are present, and it's that the cancer is found on the outer surface of at least one of the ovaries, and that possibly one of the ovaries or tumors have ruptured, and that cancer cells are found in the fluid or washings and or present when looked at under a microscope. That's Stage 1A, B, and C. Stage 2, the cancer is in one or both ovaries and has grown onto or into other organs in the pelvis, such as the uterus, the fallopian tubes, the bladder, the sigmoid colon, or rectum. And Stage 2A is that the cancer has spread onto or has grown into the uterus or the fallopian tubes, or both. Cancer cells are not found when washings from the abdomen are looked at under a microscope. Then with Stage 2B, The cancer has spread onto or grown into other nearby pelvic organs, such as the bladder, the sigmoid colon, or rectum. Cancer cells are not found when washings from the abdomen are looked at under a microscope. Stage 2C, the cancer has spread onto or grown into pelvic organs as in stages 2A or 2B, and cancer cells were found in fluid or washings from the abdomen. Stage 3, the cancer involves one or both ovaries and one or both of the following are present. The cancer has spread beyond the pelvis to the lining of the abdomen, and the cancer has spread to the lymph nodes. So stage 3A, it means that the surgeon can see the cancer in the ovary or ovaries, but there's no other sites of disease outside of the ovaries visible. Sometimes when the biopsies or tissue samples are performed and checked under a microscope, tiny deposits of the cancer may be found in the lining of the abdomen. The cancer has not yet spread to the lymph nodes, however. Stage 3B, there is a cancer in one or both ovaries and deposits of cancer large enough for the surgeon to see, but smaller than 2 centimeters, which are about 3/4 of an inch across or present in the abdomen. The cancer has not spread into the lymph nodes. And then with stage 3C, the cancer is in one or both ovaries and one or both of the following are present. Cancer has spread to the lymph nodes, and deposits of cancer larger than 2 centimeters, again 3/4 of an inch, across are seen in the abdomen. And then the final stage is stage 4, which is the stage we come to for me. I was stage 4. When they performed the surgery, the hysterectomy, they were able to see my lymph nodes were enlarged because they had the cancer present within them. So if I understand correctly, they removed about 12 to 13 of my lymph nodes in which cancer was in each one of them. Now at this point in time, I have no evidence of cancer in my liver nor any of my other organs at this time. There's something going on with my spleen, but we can't determine what that is. But through all of the scans, the CAT scans I told you about, and most ultimately the PET scan, we just didn't see any other evidence of the cancer. But it being stage 4, you kind of know it's there. So I am not being fooled by that for a minute. But anyway, I just want you to know, so stage 4 is the one where you know that you're going to be in for the battle of your life. So I've given you the 4 stages of ovarian cancer because I just want you to know each one determines your treatment phase, your means of treatment. It all is based on your staging. So I hope this has helped you today. Like I said, I will always come back with information. I really want you all to let people know that I'm here to answer those questions if you have them. So I'll be checking in from time to time, and I hope you all have a wonderful day. I thank you again for checking in, and I'm Sharon, and I'm just happy to be. Take care now. Love you. Bye-bye.